I'm going to start off with asking you guys a couple questions. Who here donates blood? One of you. All right. Who here has a baby in the family, whether it's your own child or a niece or nephew? All of you. What would happen if a baby that you know is born with a heart defect and needs a blood transfusion to survive? This is my point. I'm going to be going over today why every American capable of donating blood should do so. I'm going to go over the arguments that some people have against this topic. I'm going to go over why it should be done and how it's done. Good morning, my name is Mike Dragich. I'm going to be starting with the arguments of donating blood. A lot of people say that they're too busy and they don't have enough time in their daily schedule to go donate blood. Well, I'm going to tell you that there's no excuse for that. It is more important to help somebody else possibly save a life by giving an hour out of your day than coming up with an excuse that you're too busy to do so. The next one is that it's painful. Who here is afraid or think needles are painful? Okay, I'm not a big fan of needles myself, but you got to remember a little bit of discomfort to save a life. The benefit outweighs the cost in this one. Okay? Weakness. You do not get weak from donating blood. You won't get up, you won't be weak and sore for a week long. All right? It's a mental problem that people have when it comes to donating blood. It doesn't happen. It's a proven fact. Religion. Some groups, such as the Jehovah's Witnesses, don't believe in any type of blood transfusions, giving or receiving blood due to cultural and religious beliefs. Okay? Do I have any questions on arguments that you might have or anything that you've possibly heard in the past on this subject? Yes?
Is someone able to contract a disease such as HIV or AIDS from donating blood?
His question was, is it possible to contract a disease such as HIV or AIDS from donating blood? This is a very common argument, and the answer is absolutely not. The organizations that you go to donate blood are extremely sterile, and that is their job to make sure that you are in a very clean and sterile, infection-free environment to give these donations. Does that answer your question?
Yes.
Next, I'm going to move on to why we should donate blood. The main reason we should donate blood is because we're the only source of it on the face of the earth. Blood cannot be made. Blood cannot be harvested. The only place that you can get it is from a willing human being saying, here, you can take it. I'm going to donate it. So it's up to us. There's an extremely low supply of blood and an extremely high demand. Over 43,000 pints of blood that is donated, 43,000 pints of donated blood is used in a day, according to the American Red Cross. Okay? Now, 37% of Americans are eligible to donate blood, which means 37% of Americans are healthy and able to do so. Only 10% actually do. There's no reason that this is the case. I'm going to give you some statistics now from the American Red Cross and American Blood Centers across the United States. The first one I want to give you is that it is possible for us to give up to 46.5 gallons of blood in a lifetime from just ourselves. If you donate every 2 months from the ages of 17 to 79, you will have donated 46.5 gallons of blood to help your fellow Americans in case of emergency. The second statistic I want to share with you is that 4.5 million Americans get blood transfusions every year. 1.5 million need these transfusions to live. It could be anything from car accidents, gunshot wounds, cancer, kidney and liver disease. Any of these patients need blood to survive. The last statistic I want to share with you is that 1 out of every 7 people that go into the hospital need blood on the scene. These are a lot of scenarios that people need blood and that it is our job to be able to supply them. And it's the only one that is on the earth. The only supply that we are able to give them comes from donators like myself and hopefully you as well after this. We've covered why we should donate blood. Next, I'm going to cover how to do it. All right? It's extremely simple. You walk in the door of any nearby blood donor, hospital, or American Red Cross. You get a recent medical history, a physical. They look it over, make sure you're in good health. You donate, and then you leave. You get some snacks to replenish yourself, and you're out the door. This entire procedure takes about 1 hour long. And that is the medical history, the physical, and the snack part. Okay? Only about 10 minutes of it is the donation, to where you're actually drawing blood out of your arm. Okay? It's not much time out of your day whatsoever. You need to be 17 years old, at least 110 pounds, overall good health. When donating blood, you give less than a pint in a visit. So, for you to give less than a pint of blood in a 2-month period, and to give up an hour out of your day to do so, it completely outweighs the discomfort and all the rumors about weakness that exist on this subject. Okay? At this time, are there any final questions? Yes?
Can I get paid for donating blood?
This question is, can you get paid for donating blood? There are some types of blood and some procedures that you can donate to where you make money, but the highest demand comes from the red blood cells that are donated. Okay, this comes from the basic blood donation that we give, and this you cannot get paid for. It is strictly for volunteers that are willing to go in there specifically to help somebody out. Does that answer your question?
Yeah, it does.
Are there any final questions? Okay, in conclusion, we've covered all the arguments on donating blood. I've countered them, countered the rumors that you might have heard, made it pretty clear to you guys that it's a pretty good, positive situation for everybody. You need to be unselfish while doing so, but if that's what it takes to save somebody's life, then that's what it takes. We've also covered why to do it and how to do it. It's a pretty easy process, is it not?
Yes, it is.
At this point, I'm pretty confident that all of you are going to start donating blood to be able to help the others around you, such as your loved ones, your family, and friends. Am I correct?
Yes.
Thank you very much.